Okay, it's time to talk about Medicare Supplement plans, also known as Medigap. A lot of you have heard that term. That term supplement also is thrown around with all kinds of different plans. Some people use them to describe Medicare Advantage. Completely different. Medicare Supplement plans have been around a long time, a lot longer than Medicare Advantage plans. They were designed initially to help cover a lot of the cost sharing associated with original Medicare because original Medicare does not pick up 100% of your cost. For example, if you go in the hospital, you're going to have a $1,600 copay with original Medicare. That's on days anywhere from 1 to 60 days. Under Medicare Part B, everybody seems to know this ratio, but Medicare picks up 80%. They don't pick up 100, which leaves you with 20%. The other thing about Medigap plans is that when you're on them, Medicare is still your primary payer. So when you walk in the door at a hospital or a doctor or you need a test, you are still going to show your Medicare card. This is what you're going to show them because that's who's paying most of the bill. Of course, once you go in there and you ask them for services, they're also going to ask you, because they know you have Medicare, they're also going to ask you, do you have a secondary? And that will be your supplement Medigap plan. So just looking at this is original Medicare, all right? Medicare covers hospital coverage. It's a inpatient hospital stay, and they cover medical coverage. So your supplement or Medigap plan is going to help pick up these costs. So as an example, there it is right there. We're just going to show the 1 to 60 day example. We're not going to get into anything past there, although it would pick that up as well if you were in the hospital that long. But if you go in the hospital from 1 to 60 days, you go in for 1, 2 days, you're going to have a $1,600 deductible to pay. All right. But if you're out a Medigap plan, that is going to be $0. Your Medigap plan will pick up the cost for that. Looking at Medicare Part B, all right, Medicare, as we talked about, picks up 80%. So you still have a 20% gap in coverage, but if you have a Medigap plan or supplement, it's going to reduce that. It's going to pick up your 20% for you, okay? So you still have to add, though, a drug plan. So you're going to add a Part D drug plan because Medigap supplements only supplement Medicare A and Medicare B. They do not include a drug plan, so you must add a prescription drug plan to it. Now, there's standardized coverage with these plans, all right? Depending upon how much money you can tolerate paying per month will determine how much cost is picked up by the plan itself. In this example, it's picking up all of it. And this would really benefit somebody who has a lot of health issues and is using their insurance a lot. Also, again, there's no doctor or hospital networks with these like Medicare Advantage or the plan you have now, which could be an employer plan. That means that when you have a doctor network, you've got to use doctors who are in that network or pay more money. If it's an HMO, you'll pay 100% of the cost. Okay, now there's a video at the bottom. It's going to go through a couple of plans just to give you a decent comparison, just so you can see what they're all about. Anything we speak about is for the greater New York area. Medigap plans in other states could possibly have a medical questionnaire, in which case you may or may not get it, but that does not exist in New York. Take a look at the attachment at the bottom. It's going to show you a nice comparison. The plans are very simple. They supplement A and they supplement B. Unlike Medicare Advantage, they just supplement original Medicare, which means there's no dental or vision included with them. All right? As always, if you have questions, call me, 631-774-3786, or help yourself. Go to my website, mymedicaremike.com, and there's a lot of answers in there, okay? Thank you.